Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Today we continue our series on prostate cancer. We're speaking with a man who was offered only a couple of treatment options and was told there was nothing else to stop the disease until he got a second opinion that has him now living with no evidence of disease. I'm joined today by David and his wife Sally. They've asked us to only use their first names, so it's David and Sally today. We're so glad you're here. They are both cancer survivors, and they supported each other through their treatment. And we're also joined again by David's surgeon, Dr. Will Parker, urologic oncologist here at the University of Kansas Cancer Center. And he's going to join us to talk more about this, and he's going to help us kind of bust a myth regarding prostate surgery, and he's going to explain how a new era of advanced imaging is now improving treatment for patients like David. So how are you two doing today?
Good.
All right, you two, you're going to share your story, and we're so glad you're here. Dr. Parker, great to have these two with you.
Yes, always.
Yes.
So always good to see them.
Yes. So, David, take us back to when you were diagnosed. This was 2008 originally. Yes. How did you find out and hear the words that you had prostate cancer?
Just a random blood test. I went in and I was having a little bit of problems, and they did the blood test, and they found out that my PSA was sky high.
Do you mind describing like what some of those symptoms were, just so people might understand if they could be experiencing the same thing?
I leaked a lot.
Okay.
Had to keep paper towels in my underwear at work.
So you knew that's not normal. We got to get this checked out. So did you know much about prostate health? Had you talked about it with friends or family? Was this kind of the first time you'd heard of it?
Pretty much, yeah.
Pretty much, okay. So they tell you have prostate cancer. You go from thinking you have just an issue to cancer. What was that moment like?
Oh, crap.
Fair enough. Sounds about right.
I went to see the doctor, and he didn't give me much options. He said he wanted to use the radiation, which was treatment of last resort. And he told me even after the radiation and hormone shots, it would be 6 months to a year, 2 years max. It would come back, and there'd be nothing they could do to stop it.
And that would be it for you. So you were just
Pretty
kind of
much,
trying to digest what this would mean long term. What kind of mindset did you go into this with? That's kind of daunting to think about.
I really didn't care. I didn't think, this isn't happening to me. I'm going to fight it with everything I got.
So you had hope?
Oh yeah, there's always hope.
Always hope. Sally, how was this affecting you at the time? This is a lot.
I was just in shock. I just couldn't believe it.
Because I never even got sick.
So this is the first time you're dealing with all this?
Yes.
Dr. Parker, do you hear this a lot? Somebody just having these issues, you don't really think about your prostate till you have to, right?
Correct. Yeah, it's a pretty common story. Prostate cancer is one of the few diseases where often I'm the one telling somebody they have a problem, as opposed to them coming in with a problem. Now, in your case, you were having some symptoms, which gave a little bit of a clue, but most men are asymptomatic.
So is that good news, though, to have you don't get a lot of symptoms, but when you do, is that good news because you're catching it early, which we know is good?
It can be. I mean, I think in this case, with the PSA being as high as it was, that is a concern that, maybe this wasn't as early a detection as we would have liked. But it can be a signal where a lot of men don't have that signal that something's going on.
Remind everyone about PSA, what it should be, when you need to get it checked.
So PSA is a blood test. It's a screening tool for prostate cancer. For most men, screening should begin between 45 to 50. For men who have a strong family history, it should begin at 40. In the 40s, the average PSA is around 1, so we want to see something less than 1. As the PSA gets higher, the risk of prostate cancer goes up.
So David, what were the side effects of one of your treatments, radiation?
Incontinent.
Mm-hmm.
I had problems going to the bathroom and making it there before I went to the bathroom.
So after radiation, you're put on then hormone therapy, as you had mentioned. Was that a pill or a shot?
Shots in the stomach.
And what was that treatment like?
That was easier than the radiation. It was just go in every couple of months to start, and then it worked its way to, I think, 6 months, the last 2 shots.
So Dr. Parker, hormone therapy, it can slow down the cancer, it can't stop the cancer, I understand. Is there any way to know how long hormone therapy will stay effective? Like the doctors were kind of telling David in the beginning, we'll just kind of ride this out.
That's a great question. So hormone therapy isn't curative. It is a controlled treatment. In used with radiation, it makes the radiation more effective. So it is in those settings given with this idea of curative intent. But once we start somebody back on hormone therapy, like in this situation, if you look at historic data, hormone therapy will work for about 8 years before the cancer figures out how to grow despite the hormone therapy.
So David, it did eventually stop working, stop being effective. How did you end up getting referred then to Dr. Parker in the University of Kansas Cancer Center?
The VA. I was going to an oncologist and urologist at the VA for treatment of it, and it just kept getting worse. So they said, we need to send you to a better doctor. So they did.
So they did, and here he is. So, Dr. Parker, is that typical? Would you know, he goes somewhere else, they say radiation, check, then the hormone therapy, check. Is that what you would normally expect to see maybe before somebody would get to you? Is that a normal path or just the typical?
It can be. I mean, you know, somebody's initial treatment is going to dictate what the next treatment is. So for most men, the decision is either surgery or radiation, and the subsequent treatment is whatever we didn't do the first time. Unfortunately, a lot of men who get radiation aren't really offered surgery as a secondary option if their cancer does come back. And so there's this common myth out there that if you get radiation, there is no role for surgery. And that has a lot to do with just the side effects of taking out a prostate after radiation and the complexity of doing that operation. It's not easy, and so not a lot of people offer it.
Okay, I was going to ask you where the myth came from, but
That's where it comes from.
So, what questions then, if somebody's out there and hears you saying what you just said, how does a patient know to bring that up with their doctor? If somebody says, hey, let's do radiation, you're like, well, wait, maybe we should do surgery. Of course, this is where the old second opinion comes in, but how should that conversation go?
Yeah, I think on the front end, if you're out there and you're being diagnosed, so kind of just new diagnosis, you're getting counseled, if you don't feel like you're being given all of the options, if somebody isn't going through both surgery and radiation, you're not getting a balanced discussion about what's available to you. That's really the time to really strive for that second opinion and find out what else is out there.
Okay, if I'm with you and talking to you as a doctor and you're supposed to be smarter than me, and then I say I think I need a second opinion, that is not an easy conversation to have as a patient. So explain to people why they should feel comfortable when you're talking to a really good doctor. They're okay with you seeking that second opinion.
Oh yes. So first off, I love it when people ask for second opinions. Even when they're talking to me and they say, hey, look, is there somewhere else that you want to go? Absolutely. I'm very happy to facilitate a second opinion, have somebody see somebody else. You know, that's the way knowledge is shared between both patients and their providers, also provider to provider. You know, we're just people at the end of the day. Nobody who actually cares about you is going to be offended about you asking about a second opinion. And if somebody is, you probably shouldn't be being treated by them.
Get out of there.
Correct.
Great. Okay, so I want to, Sally, how are you handling all of this? You know, as a partner, talk to us from your perspective, what kind of questions you had and what you two were
I think I
going
was
through.
so stunned, I really didn't know what to think.
Because he was always so active and healthy, right?
Yeah. He went to work every day. No matter, and I know he hid all the hurt he had. So.
Okay, and that's another problem, Dr. Parker, hiding all the hurt they have. That's
Correct.
not good. And that makes your job harder because by the time somebody gets to you, you're having to deliver that news, right?
Correct.
So make men feel better about it. Tell us something that can give men this kind of the power to say it's okay to talk about it.
Well, I mean, I think we have to normalize it, so it's on us. We have to talk about it more. Things like this, I think, help with that. So thank you, you know, and thank you all for being here. It's all about normalizing the experience and making men feel comfortable going through this and understanding there are options and there's a life after this treatment. You know, I think a lot of guys kind of put their head in the sand and think, well, this isn't going to affect me. This isn't going to be a problem. And then by the time it is an issue, it's a much greater issue than it could have been.
It's nice to see men starting to talk about it more and more, and it definitely helps. And Dr. Parker, we had mentioned this new era of imaging, and we have some slides. Let's do a little show and tell, kind of proving the difference. So what are we seeing in this bone scan and CT?
Yeah, so this is what we would call conventional imaging. So if you go back maybe 5-10 years, men who were diagnosed with prostate cancer would get this type of imaging, which is the analogy I make, it's like flying over in a plane at 40,000 feet and trying to pick out streets. There's not a lot of detail you can really pick out from these images. And so often we would underestimate the severity of the disease or overestimate, depending on the situation.
So now there's a more advanced scan, PSMA PET scan.
Correct.
What is this able to show you?
So PSMA is a protein that's expressed on the surface of prostate cancer cells and some other cells. And so we are able to deliver an imaging agent that attacks or targets that particular protein and then lights up so we can see it. So if you're looking at the imaging, you can see some areas that show up very dark. Those are tissues that take up this contrast. So for instance, the salivary glands and the tear ducts in the face take up that contrast. That's why the face kind of lights up. But it allows us to really localize the prostate cancer. And in this situation, this was a huge benefit for treating David's cancer.
Let's see a side-by-side, an older bone scan on the left, newer PET scan on the right. Clear to see, it's much clearer to see. So how did this affect the way you were able to decide what kind of treatment David was going to get?
I mean, this affected it greatly. So just to put it in context, the situation that David had was called castration-resistant prostate cancer. So it was a cancer that was growing despite hormonal therapy. And we were dealing with a cancer where the prostate was still in place. And that's a very rare situation to be in. And if you look historically, men who had that situation were hardly ever cured. And one of the reasons is that the imaging that we had meant that we didn't understand if the cancer had already spread or not. With advanced imaging, we can know pretty accurately, is the cancer localized in the prostate or is it somewhere else? So that I can make sure if I'm going to offer somebody like David an operation to try and salvage this situation, I'm not doing it in a place where I'm already set up to fail. And so it really helps us make sure that we're selecting patients appropriately and offering surgeries appropriately when it's going to have the greatest chance for benefit.
So David, you are presented with this option of surgery. Do you remember kind of what you were thinking or what questions you had? What did you and Sally have to talk this through?
I don't think we talked it through. I think we just said, do it. Got to improve my golf game.
Absolutely. I love your priorities. These things are very important. So, Dr. Marker, we talk about, again, this second opinion. But this is where a second opinion, specifically prostate cancer, it can help a patient. So, again, we mentioned that, and we just want to continue to reiterate the importance of kind of taking your health in your own hand and being your own advocate.
Exactly.
And talking to people. And talking to your golf buddies. You could do that, right?
Oh, yeah.
Do you?
Yeah. A little bit. They've both gone through treatment, so.
People have gone through. Okay, so you
yeah.
can talk about it together.
Yeah.
Good, good. All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All that information is right there on your screen. Okay, so one cancer in the household could be hard to battle. But Sally, you were also facing breast cancer during some of this. When were you diagnosed? How did you find out?
January of 2020, right before COVID.
Wow.
So when I had surgery, and then when I went through my chemo, Dave couldn't come into the room because everybody was,
Quarantine.
Yep.
quarantined. So I had to face all that by myself. He had to sit in the waiting room, but he took care of me completely. He did everything.
So you did chemo, radiation, surgery, all of it?
Yeah. Surgery first, chemo, and then radiation.
She almost died twice from the chemo.
So what was this like for you then? Here you are trying to take care of her, and she's wanting to take care of you through all of these experiences. How did you guys handle that?
You just do it.
Yeah.
You just do it. You just do it.
If you love someone, you do it.
That's right.
So were you able to be there and support each other? Did you guys have outside support? Did you use any community resources?
Just
Okay.
friends.
Friends, family? Good, good. And you guys travel a lot, right?
Try to.
Tried to? I think that's when I first talked to you. You guys were on the road heading somewhere.
South Dakota.
South
Devil's
Dakota. Yeah, you
Tower.
guys were hitting the open road. Like you had me on speakerphone and you were like,
Uh-huh.
we don't even know where we are, out in the great wide open. I love that. So David, Dr. Parker removed your prostate. We know that recovering from that can take some time, can take several months. How long until you started to actually feel better? And then when were you able to get out there on the golf course?
2 months.
2 months. You were starting to feel better, or were you back at
I was
life?
back at playing golf for 2 months and going to the gym almost
Really?
every day. Yeah.
Wow. Okay, so what about surgery? You had surgery, you had a scar?
6 or 7.
Okay.
There,
Here's a picture.
Tell us what's going on in that picture.
I'm still in the hospital, I think.
But any other issues when you were recovering? Was that nothing? Is that
No.
pretty typical, Dr. Parker? A couple of months get back to life?
That is pretty typical. Most men, and I think experiences vary from person to person, but most men would say that by about 4 to 6 weeks they start to feel relatively back to normal. There's still some limitations and some recovery going on, but that's the nice thing about robotic surgery and the way we do this today is that with small incisions, the bounce back is pretty quick.
What about the leaking? Was that, I mean, you said that was such a big issue. Was that?
You learn to sit down.
So is that gone? Is that still?
Pretty much.
Pretty much, okay.
You still have to wear a pad, and I've been told that I'll have to wear it for the rest of my life, but
What's the
So,
alternative, right? Not golfing, not traveling, and not
Yeah.
being with Sally? That's not
I
fun.
can't give God no laughs. I mean,
Yeah.
God's a golfer. He loves to watch me
He
fail.
really is. That's such a poignant statement, and I think it's very, very accurate. But your doctor told you to count, somebody was telling you to count how many times you golfed?
Yeah, a long time ago, my doctor at the VA asked me to write down every day that I got 10,000 steps in, went to the gym, how many times I walked 9 holes of golf. So
Dr. Parker, he's kind of a good patient. Like,
Oh.
he's not just sitting around, but just getting, is that what you would want and expect from somebody to be able to just get back out and do everything they were doing?
That's what I would want. I want people to go on and live life. I mean, that's the whole purpose of going through all this. But the reality is your recovery is in your own hands.
you
Right.
can't give up.
No.
You give up and you're done.
And Sally, how are you doing, by the way?
I'm just a lot better.
a lot better.
My energy didn't come back like his. Mine took almost a year to get back to being active. But I still quilted
Okay, tell me
almost
about
every
this
day.
quilting. You're so crafty. Tell me all about it. I think we have a picture of something. And I guess your husband says that you guys are constantly in craft stores in and out.
Oh yeah,
All over town.
that's my latest quilt. It took almost a year,
Really? How long have you been doing that?
since '93. I've made several quilts, given a lot of them away, charities.
You're an artiste. I love that. So, David, you're back at it, but what does your maintenance care look like now? Are you
It's,
going in to see your doctor? Do you have to
yeah.
see Dr. Parker much anymore?
not so much Dr. Parker, but I go like every 3 to 6 months at the VA to get a blood work.
Is that pretty typical, Dr. Parker, survivorship? I mean, what does survivorship look like for somebody who's gone through the path that David has gone through?
Yeah, I think there are a couple of pieces to think about. So there's the cancer survivorship piece, which is the getting the PSAs checked, stay on top of it to make sure that if there is a sign for recurrence, we find it early and react to it early. Then there's the other piece, which I think is actually the bigger and more important piece, which is getting people like David back on their feet. So getting the urinary control back the way they want it, getting their just life back into a shape that they want it to be in.
We've talked about people getting cancer like in younger ages and certain types of cancers. What about prostate cancer? What's the typical age that you normally see? Is there kind of that spot where people really need to be paying attention?
Yeah, so the median age of diagnosis is 67. Now, some of that's driven by the fact that previously the screening guidelines started in the mid-50s, and so we would find prostate cancers a little bit later in life. I'd say we are seeing it shift earlier, and so we're finding it more in men in their 50s, but we're also finding it at earlier stages, which means better treatments, less side effects, people bounce back faster,
Right,
better
so
cure
that's
rates.
kind of some good news and
Correct.
mixed in with that.
It
so,
is.
all right, let's get to some questions from our viewers this morning. And Stuart wants to know, what's a Gleason score, and does it dictate what treatment options I can get?
Yeah, that's a great question. So prostate cancer is graded. So unlike some cancers where you just have the cancer, prostate cancer is graded on a scale. There are 2 scales that are used today. One is called the Gleason scale, which if anybody's ever been through prostate cancer treatment, it looks like a math problem. So it's a scale that goes from 3 plus 3 to 5 plus 5, which is a little bit of a clunky system to use. And so there's a better system that we use today called grade groups, which is a scale from 1 to 5. It helps us understand how aggressive the cancer is in terms of should there be other imaging ordered before we offer a treatment, so like a PET scan or an MRI. But it does also really help us understand what the most appropriate treatment would be for somebody.
Another question is, what was David's original PSA and what is his PSA now?
PSA now is non-existent. PSA when I first was diagnosed was 318.
And when you hear that, kind of give us a range. I mean, that obviously sounds high, but you've seen higher. Is that the highest? What kind of?
Not the highest. I've seen as high as 20,000. So PSA is a continuous number.
Wow.
I know. So it's a continuous number. Now, most men who are diagnosed, the PSA is less than 10. And when it starts to get above 20, we get extremely concerned. When it's above 100, it's very, very concerning. And so when men show up with PSAs in the 300s, it is a serious and significant situation.
Okay, so Yen has a question. So we know that PSA levels may rise and that might be a sign of prostate cancer, but can someone ask if a biopsy is necessary to definitely confirm whether it is cancer or not? I think it's like, if it's high, does that naturally mean it's cancer?
No, it doesn't naturally mean it's cancer. So prostate cancer causes the PSA to rise, so do a bunch of other things. And so because of that, a biopsy is required to make that diagnosis. So there's no diagnosis that happens without doing a prostate biopsy.
All right, Jeremy wants to know, if everything goes well, how long from beginning of treatment until things are back to normal and you're not needing to come back in for appointments?
You know, that's a really good question. And I think some of it depends on the situation. So excluding David's situation, which I think is very unique in kind of how it progressed and played out. If you take an average person going through treatment, most men feel good and are relatively well recovered by about 6 months. That's from quality of life recovery, like urinary control, sexual function. But we follow men for the rest of their life. Prostate cancer is a disease that can come back at any point in time. And so because the screening for follow-up is just a PSA blood test, it's easy to have men come in once a year throughout the rest of their life and just make sure that there's not
why wouldn't you?
Correct.
Is the robotic surgery just standard these days? Or that's it?
That is. So 99% of all prostate cancer surgeries now are done robotically, which is a great improvement.
All right, question, very important question. How did Sally pick up quilting?
I had a hysterectomy in '93, and I said, "Oh, I got to sit around the house for 3 weeks. I got to do something."
And you picked up a hobby like that, lifelong hobby. That's fantastic. Good
Love
for
it.
Good
Love
for
it.
you.
Try to do it every day.
Sally, what is the big takeaway from this story, from your personal story and with David?
The people have to get checked. They have to be proactive in their life and not expect a doctor to tell them what to do.
David, what's the big takeaway?
You find out who really loves you. When you have a problem, you got to have somebody to help you.
If you don't find somebody.
Yeah, keeps your head on straight, so you can't give up.
Well said. Dr. Parker, what's the big takeaway?
Yeah, I'd say two takeaways. One is, you need to be aware that there are a lot of options out there, and in situations where it seems very complex and where you're not given a lot of options, that's the time to start asking questions to see if there's something else that could be done or can be done. Because I'll be very honest, this is a situation where I don't think a lot of people would have gotten to the point where David has gotten, and this is really a remarkable case. The second thing is and this goes back to David's personality and what he's doing, you have to be active and engaged in your health care. And that's in all parts. Golfing every day, walking every day, that's a part of healthcare. Because it's staying active, it's staying healthy, and I can't understate that enough.
Yeah, it puts you back into control. All right, thank you. As always, thank you both for being here with us
Thanks
today.
for having us.
Appreciate you sharing your story. Thanks to our viewers as well. We'll see you back here tomorrow. A Purple Heart veteran thought his battle days were behind him until he found himself in a battle to save his own leg. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Medical teamwork, why doctors at the VA trusted surgeons at the University of Kansas Health System to lead the fight. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.